The following teaching DVD will do arterial blood gas sampling. Prior to doing any procedure with a neonate, you must carry out hand washing technique using the 7 steps. After hand washing, you should always apply a alcohol gel. Again, using the 7-step technique. We're now ready to get our equipment gathered together for carrying out our blood gas sampling. Now we're ready to gather our equipment together. We'll need a blue tray, our flushing solution, which is a heparinized solution, 2 syringes with caps to protect our key areas, Clinell cleaning wipe, and our blood gas syringe. And again, another cap to protect it. What we need to do first is clean down our tray, and we clean from the inside first. And then out to the outside. And allow that to dry. We're going to get our syringes out. With your blood gas syringe, you just push that up to make sure there's no air in it, and that's already covered. Now we need to draw up our flushing solution. And we're using a Clinell wipe and using 4 corners and cleaning the top of your key part. And allowing that to dry. Once that's dried, you're going to draw up approximately 1 to 2 mils. Make sure there's no air in it. And again, cover your key part. We'll need another Clinell wipe for cleaning our port entry. And now we're ready to go to the baby and take an arterial blood gas sampling. Okay, prior to going into the baby, we need to use a hand sanitizer. Again, use the 7-step technique. Put on gloves. We're going to identify we've got the correct baby that requires a blood gas sample. Again, checking the name band, armband. The next thing we need to do is identify our arterial line. And what we do is follow the umbilical line, check that it's arterial, clearly labelled, and the line that we're going to be accessing is labelled as arterial. We're now going to clean the port which we're going to take the blood gas sample from. Again, using a Clinell wipe, use the 4 corners. And allow to dry. The first syringe that we have has nothing in it, and we're going to attach this on. And what we're going to do is turn off the fluid that's going to the line to keep it patent, and you use the little lever and turn it off. So at the moment the port is open from the syringe to the umbilical arterial line, which is going into the baby's umbilicus. And you're going to withdraw very slowly, approximately 1 to 2 mils. And you're observing the baby all the time, observing the lower limbs, ensuring there's no discoloration. Once you've got your fluid withdrawn, you're going to take any air bubbles out of it, push it up to the top, and put on your protector, because this fluid and blood will be going back to the baby. Okay. Now you want to take your blood gas syringe and withdraw your arterial blood gas sample. Again, watching your key parts, making sure they're protected. Insert and withdraw. Approximately 0.2 of a mil. Okay, once you've withdrawn your arterial blood gas sample, you just need to protect that, and you withdraw all the way down to the end of the syringe and then up again. Make sure there's no air bubbles in it. And set that back in your tray, ready for sampling. Now you want to replace the fluid that you withdrew previously. Make sure there's no air bubbles at the top. And attach that on. And again, you're going to just withdraw slightly, making sure there's no air bubbles, and if there are, flicking them up to the top before pushing your fluid and blood back into the baby. Once we've administered the fluid and blood back into the baby, we now need to flush the arterial line to make sure it's patent. We take our heparinized flushing solution, attach that on, making sure there's no air bubbles in it. And prior to administering it, we just want to withdraw back very slightly, just to see a little puff of red, and that's just to make sure that there's no air in the chamber. If there's any air, you want to flick that up to the top. And now we're ready to flush the line. Very slowly, again observing the lower limbs. We only flush enough fluid in to ensure the line's patent and any blood that's sitting in the line has been removed. Now what we need to do is turn off to the syringe and ensure our fluid is running into the umbilical arterial line to keep it patent. So we turn our lever round to off, so it's now off to this port. Remove our syringe. Take another Clinell wipe and clean the port. Again, we use Clinell wipe, use 4 corners. Allow it to dry. So you set that down. And again, just touching and ensuring that the lower limbs are good circulation and they don't feel cool to touch. Make sure your baby's left comfortable. And now we're ready to go and take our arterial line sample for sampling. Ensure you remove your gloves and apron from the baby's bedside. Hand gel. And go and get your